AISE discussion, focused on gender-based violence. Lessons from the field.
Welcome everyone to this AISE discussion series episode with a focus on gender-based violence. Today we have Professor Els Leye. Before I go into more details, I'd just like Els Leye to introduce herself, and then we'll give you more of a background on what this webinar is about.
Okay. Hi, good afternoon or good morning or good evening, everyone. I'm Els Leye. And I'm a social scientist from background, and I've been working at the International Center for Reproductive Health at the Ghent University in Belgium for over 20 years, where I mainly focused on doing research on gender-based violence and on harmful practices, so-called harmful practices, which include female genital cutting, child marriage, but also I focused a little bit on hymen reconstructions or cosmetic genital surgeries and the parallels with female genital mutilation, and then also more broadly on gender equality. So that was my basic focus of research, and I am also now an independent consultant because I will stop working by the end of September at Ghent University, and then I will be fully independent, full-time independent consultant on the same topics as I just mentioned.
Thank you, Els, for that introduction, which doesn't do any justice to your experience and the work you've been doing. And we are so glad to also have you as an external consultant, of course, at AISE Consulting. And I think your expertise always adds value. So, Els, given that very brief introduction, because I've known you for a while and I know there's so much more to that introduction than you've given to us, just tell us a bit more. Why gender-based violence? Why the focus on health? And why have you been doing it for so long? Because it's about over 20 years now, I think, or almost 20 years. Yeah.
Well, I started my career at the Dutch-speaking National Women's Council in Belgium. So women's rights were always at the very core of my interest and values that I carry personally. And I worked at the Women's Council for, I think, a couple of years, something like that. And then there was the opportunity to go and work at Ghent University, and I was involved in the project on the rights of female sex workers, so AIDS prevention for female sex workers in Europe. And via that job, I heard about the International Center for Reproductive Health that was going to be created somewhere in the mid-90s. So I joined the center from the very beginning. And at that point in time, we were informed that the issue of female genital mutilation or female genital cutting was really an issue that came to the fore in Europe. And it was the European Commission and European Parliament who said, well, we don't know anything about this issue. And that's how I started working on that issue. So doing the first study back in, I think it was 97, 96, 97, I started the first study on female genital mutilation, female genital cutting in the EU. And since then, many more projects evolved out of that very first one. And then in 2008, I got my PhD on that same topic, on female genital mutilation in the European Union. And I continued working on gender-related issues and in particular gender-based violence, actually.
Els, it's such an amazing story. And I think what makes your story very interesting is the perspective you have. Of course, working on female genital mutilation and gender-based violence issues at the EU level, it must be very different from some of the work you've done in different countries as well, because I know you've done some work also in sub-Saharan Africa. And could you speak to that a bit about the differences in both environments working at that high policy level and also working on some of the projects?
Well, I must say it wasn't always easy, you know, to work on an issue like FGM, as a white woman, as a, you know, a highly educated. It wasn't always easy to work on that issue, and a couple of times I've been questioned about that, like, why are you involved in the topic? This concerns only African women. But for me, it was more like a women's equality issue. It's more, yeah, for me, it's a human rights issue. And to me, human rights apply to all women worldwide. It's not like human rights apply to certain groups of women, or, you know, so yeah, to me, it's more like a universal issue, the gender equality of women. So, but then of course, yeah, at working at EU level, or at doing your research to inform policy development, I always think it's quite an important thing to do, because especially in the European Union, you have like a lot of policies being developed at EU level that have to be transposed into national legislation. And sometimes people are not well aware of how important that EU level is, and how much it can determine how in practice the laws are developed in your own country, like in Belgium, for example. So that is why I think it's really important to contribute to policy analysis, and to work at EU level as well. But I've not only done research, I've also been involved in the creation of a European network to prevent female genital mutilation in the European Union. And that network was really not only researchers, but it was really a multidisciplinary network. So we had like health professionals, but we also had community-based organizations, and then also researchers. And we tried to collaborate to really develop common agendas and common approaches. And out of that very first network developed actually also the End FGM Europe network, which is now very, very active, and also very successful, I think, in lobbying the European institutions to really keep the issue of FGM on the EU agenda. So, yeah, to me, that is one of the things that satisfies me the most, that I've been able to contribute to create like a network of community-based organizations to really give a voice to the women and the girls who are actually victims of FGM. Yeah.
No, it's so wonderful to hear you speak about that, and to speak about it with so much passion. And I think there's always, as you said, there's always that division. We always either work at a policy level, or we work at grassroots level. And very few times is there that intersection where people realize that even though you are implementing services in the community, even though you're providing services at a grassroots level, it's also very important to deal with policy.
Yeah.
And over the years, have there been gaps that you've noticed in working in the area of gender-based violence that keep on reoccurring? Are there some key take-homes or key learnings that you've learned that you'd like to share with us?
Well, of course, there is still a lot of work to do in terms of gender equality. And one of the things that worries me the most lately is that the issue of gender equality, especially in the European Union, is more and more getting under attack. So there are more and more countries who really start doubting the word gender, or the concept of gender equality. So they call it like a gender ideology. So to me, it's like we're going backwards a little bit in some of the EU countries, and I think we need to be really very vigilant that you know, that gender equality is being kept high on the agenda, and that we are quite aware of those strategies that, you know, in some of the countries, be it for political reasons or ideological reasons, that people opposed to gender equality, but we need to make sure that the things that we gained in the past decades of working on gender mainstreaming and gender equality, that we don't lose that. And I think it's especially also true for the rights of like the LGBTQI community. It's especially there that there are quite some tensions now, and that we need to find an answer to really make sure that those countries are being kept on board. And just to give you an example, I contributed lately to a study that assessed the added value of the Istanbul Convention. So, you know, you have like the Istanbul Convention, which is a binding instrument to tackle violence against women and gender-based violence. And I contributed to a study to just have a look on how this Istanbul Convention contributes to putting and tackling and preventing violence against women in Europe. But we also looked at how the remaining challenges, and one of those challenges was actually this raising trend of questioning gender equality in a number of European countries. So I think that is something that really worries me, actually. Yeah. And then another issue, sorry, another issue I think is also the issue of intersectionality, that we need to be more, or to integrate more in doing research and doing policy analysis, is really looking at the intersecting axes of discrimination. Like, for example, violence against disabled women and girls, for example, is really a major gap. It's really very hard to find studies or papers or reports that really look at the intersection of disability and gender, for example. But then you also have, of course, ethnicity as an extra axe of discrimination. There is religion that can also be an extra axe of discrimination. So all these different forms of discrimination and how they overlap and compound each other, I think this is also something that we really should focus more in our research, instead of just singling out, for example, FGM or child marriage, but really look at the intersections.
You know, that is such a useful and very nuanced reflection, because I think in our field, we often fall into the danger of picking up silos of expertise or focus, just because, you know, we want to target population, we want to deal with certain issues. But the truth is that there's never one issue, you know. You can focus on particular parts. Like, for example, you can work on FGM, female genital mutilation, and reducing prevention, and focus on prevention or addressing it afterwards. But if you don't look at the spectrum of what's going on in society, or how multiple identities, as you said, by using the lens of intersectionality affect vulnerability, it has an issue with how sustainable your project or program is. And I think what you mentioned earlier about taking back, like being very cautious about the gains or the progress we've had so far being taken away from us, is very powerful, because we've reached a space where now there are conversations about, should we constantly put that focus on women in our discussions? Is gender equality not already reached? Are we making too much noise about it? And I really like what you just said. Please, could you speak more about that, about how we need to pay more attention to making sure we haven't lost some of the progress we've already achieved?
Yeah. I feel very strongly about that, you know, because I think gender-based violence disproportionately affects women and girls in the world, everywhere in the world. So gender equality is by far not reached. I mean, in Europe, of course, gender equality is at another level than, for example, in sub-Saharan Africa or in South Asia, for example, where you have for example, in terms of violence against women, the challenges are much bigger in South Asia, for example, or in sub-Saharan Africa than there is in Europe. But still, I think we should be really very careful that we are not going to sleep or fall asleep, because it is not because after decades of working for gender equality that now we have reached it and that we cannot go back. So this is really something I feel quite strong about it. Of course, I think it's also very important not to lose sight that violence can, of course, also affect men and boys. Absolutely. So if you do a research, it is also important to integrate or to look at how violence affects boys and men. But my personal focus will always be on women, because I still think women are disproportionately affected by the issue of gender inequality and unequal gender norms. And I've been puzzled by it, since I was a young girl. I was puzzled by how is that possible that women are discriminated all over the world. How come? I'm trying to understand and trying to grasp why is that, and how can we tackle it, and how can we prevent it. So yeah, for me, this is, you can call it the mission of my life, I don't know.
Based on your experience so far, what have been strategies or interventions that you found have been very useful, or ways to address some of these issues that have used an intersectional lens?
Wow, that's a broad question. I would say that one of the main things to do is really try to have a community-based and a participatory approach. So if you're doing research, for example, that you really go and, not you as a researcher from your ivory tower is going to develop this brilliant research project, but that you really see what the needs are in certain communities, and that you just facilitate or you put at the disposal your expertise that you have in writing a proposal or facilitating some of the research methods, etc. So this participatory approach, I think, is really key, a key dimension. I also think that when you finish a research project, going back and sharing the findings that you have and sharing it with those where you did the research is also very important. There's so many, there's so many lessons learned, actually, and even per topic, for example, on female genital mutilation or child brides, or there's so many topics that you can look at, and so many lessons learned, I would say. But what exactly is a good lesson in general? It's a very general question, actually.
I was thinking, if you could offer some advice to academics or people working in the field, some things they need to think about when implementing interventions or engaging with policymakers, what would be some of those things?
Well, as I said, I think your departing point should always be an assessment of the needs in a certain community, or and from there you go into discussion on what exactly is the need, and then go into discussion how you can really fulfill that need, and how you can develop a research design that is really targeted at that specific issue and that specific population and that specific context. But especially when it comes to violence against women, I think it is really very important not only to look at the individual in a certain, how an individual experiences violence, for example, but that you also look at the broader context in which that individual is living. So it is really important to have a look also at the context, the whole context, and not only the individual in relation with its family or or partner or children, but also the broader community is important to take into account. Also the national context. What are the policies? What is the economic situation of a certain country? How does poverty influence the experience of that particular woman if she's in a situation of violence? So the whole picture around it is really important. And more recently, of course, also climate change, for example, which also has an impact on violence. But the COVID-19 pandemic, for example, also had an influence on, it was a worldwide pandemic, but it can really affect a single woman if she's in a situation of violence. So an experience of violence is never, isolated from the broader context. So that's why I think it is also very important to keep that intersectional lens, and also to really make sure that you contextualize your research. That it's not just, developing a survey and then go to that woman or that girl and then ask the questions and that's it. No, it's like, the whole context. It makes it very complicated and difficult.
Yeah, of course,
I think it's really necessary to do that. Yeah.
No, that's a very good point, because I think I find that most times people either involve the research participants, like just in the study itself, or sometimes they might people from the community might be involved in data collection process, but hardly in the beginning with formulation. And also what you said, there tends to be a focus on collecting data on that individual, but there's not always this more holistic or comprehensive approach that looks at the environment and multiple issues, because poverty is such a big issue in many settings. And of course, as you mentioned, climate change as well.
Yeah, but it's not always easy, and especially with diminishing funds. And, to me, that has been one of the major challenges in the past maybe 5 to 10 years, is really trying to find funds to do your research and to really make sure that you grasp the whole situation. But sometimes you apply for funding and you design your research proposal, and then it's approved, but then they cut the funding with 20-25% or even more, and then you're like, okay. So this is really a challenge, actually. I really think research needs much more funds, actually, to really do the research, especially when you do qualitative research. Qualitative research is really time consuming and resource consuming, because if you go for doing in-depth interviews somewhere in a rural area, in an African country, for example, that this will include transport costs and costs of, having devices to really make sure that you can record the interviews, etc., etc. So there are quite some challenges, actually, and I think the financing the research is one of those challenges.
There's some things that you're proud of. So you've been in this field for 20 years. What are some of the achievements we've made, you think?
Well, I was particularly happy about being able to produce some reports on female genital mutilation in Europe, and how that has contributed to really developing some of the policies at EU level. Like, for example, some of the European Parliament resolutions at the earlier years were based on some of the research that I've done. So it's good to see that your research is not done in vain, and that it's actually being used to really try to formulate some of the policies at EU level. And then one of the other things was that European network that was created, which I think was really something very empowering for the community-based organizations, because there were some scattered organizations working in Europe, but they were not joined. And I think, in French we say, l'union fait la force. So, if you join forces, you get more powerful and you gain strength. And this is really something I strongly believe in, actually. together you can reach much more than as an individual organization or an individual researcher. So the exchange of ideas and, you know, the exchange of strategies that were used to go and reach out to the communities who actually practice FGM. So yeah, that the creation of that network is also something that I'm happy it's there, and it's still very much alive. So that's really something very good. Yeah.
Well, talking about this translation of research, because it's not often we find that you do research and it gets translated into policy. Could you talk a bit about how that happened? Because that doesn't always happen in our field. It's not just because you do research doesn't necessarily mean there'll be an uptake.
I think it is because at the International Center for Reproductive Health, it has always been one of the concerns, or one of the strategies was to involve policymakers within the steering committee of ICRH at the beginning. But now we also have ANSER, the academic network for research on sexual and reproductive health policy, which I think is really very, very important, that you really see how you can really translate your research into policies. And I think that is one of the major assets of the International Center for Reproductive Health, that this has been one of the strategies. Because I started my research because there was a member of the European Parliament really who was at the board at that time of ICRH, and who really said, look, this issue of FGM, this is really emerging in Europe, and the European Commission has no idea what to do about it, what it is, you know, how you can tackle it or prevent it, what the European Union should do. And so if you get that inside information from somebody who's really a member of the European Parliament, then you can really target your research specifically on that. And that's how it started, actually. So I think that is one of the strategies that is applaudable, I think, to really involve policymakers in your board of directors or steering committee, or, you know, workshops, or but just think about it, how you can do that.
And one question I have is, if you were to advise young health and development practitioners so fresh out of school, idealists, who want to work in this area, what are some 3 messages or 4 take-home messages would you say to them to be aware of while working in this field?
First of all, I would say that, you know, you should continue focusing on what you feel very strong about. You know, this is really, for me, it's really a personal drive in my professional life, because I still think it's really one of the main issues that need to be addressed. So it keeps you going. It also makes sure that you keep an open mind. This is also one of the things that I think you should be, it should be one of your capacities, like having an open mind, not just, you know, being strict or focusing too strict on one issue, but keep your mind open, go into dialogue with policymakers, with community-based organizations, with other researchers, but, you know, make sure that you have that open lens and try to take in what they set as, or the priorities to focus on, and see how you can translate it into your own research and your own focus of research. Yeah. But for young people, of course, yeah. I mean, the academic world is not, it's sometimes challenging, you know, it's sometimes, in terms of, as I said, finding sufficient funds to do your research, or and all the other tasks that you have. I really like to do research. This is really something I really like to do. But of course, when you work in the academic, you have the teaching, you have all kinds of other things that you have to focus on. So it's important to really stay to your focus and to what your own personal values are. I think that is also something quite important, which I've learned in the past years.
No, I really like that. And I have to say, one of the things that, so we've known each other for a bit, Els, and one of the things I find very endearing about you is passion. It's never felt, I've seen you work on different projects, and I've never felt you did the projects just because they were there. It's always when you talk about them, and I think sometimes you're unaware, but I think when you talk about them, there is passion, there is that human connection and commitment to what you're doing. And I think that's something that is easy to forget when you're constantly working and you're trying to achieve goals, or you have, for researchers, but also for project implementers, when you're so focused on the end goals and targets and milestones, sometimes we forget the passion, the reason why we started doing the work we were called to do in the first place.
I think some people might say that I'm stubborn, that I'm because I've over 20 years I've been working on this issue of FGM. So some people say, it's why do you continue working on that? And I'm like, but yeah, there are always new research questions popping up, and it's never done. The work is never done. So
No.
And some people see it like a marginal issue in Europe, which it is not, I think. Some people say I'm stubborn, but I like it when you say I'm passionate. So let's stick to the passion.
No, it's true. And I think you said something very important also in the beginning. And I think this applies to so many different issues. There's a tendency, and I think the more expert and the more experienced you are, there's always a tendency for us to focus on one issue or to prioritize different issues. And like you said, sometimes people might think one issue is marginal, but I want to use none of us is free until all of us are free. And that applies to so many things, but also applies to gender-based violence and many other inequality issues. Once there's a problem, it leaks to every other problem. One is not separate from another. So until we've addressed female genital mutilation, child marriage, interpersonal violence, sexual and reproductive health, the issues around access, once you focus on one without acknowledging that the other is also important, you can never address any, because they all come from the same root problem, which is, as you said, discrimination and inequality.
Yeah, exactly. Yeah. And even if it's like one issue, FGM, it touches on so many other things, so many disciplines also, because you can tackle it from the gender norms point of view, but you can also tackle it from the human rights and the legislation or the policy view. Okay. You can tackle it from a health perspective and do research in that area. So it's like, it's a very complex issue, and it touches upon many aspects, which are, of course, also applicable to all the other sexual and reproductive health issues as well. So, yeah.
There's one experience they had in the beginning of their career or in the beginning of their work that struck them. And anytime they talk about that experience, sometimes it's not as big or as monumental as experiences they have as they advance in their career. But that experience always makes them smile or cry, and they're very passionate about it because it was a life-changing moment. Do you have one of those experiences you would like to share with us?
There's so many things to tell, of course.
I imagine.
I just remember the very first conference I organized. It was in 98, I think, or 97. And so we did this one-year project, the first project on trying to document what was happening in the EU on FGM, in terms of community-based organizations, but also in terms of legislation and in terms of the health sector involvement. And at the end of that 1 year, I had to organize a conference. So it was like a very, like very innovative or a very new thing. Let me put it that way. It was a new thing for Europe. So there was quite some interest in that conference and quite a big audience. But all of a sudden, also the national television came. And at that time, I was, yeah, I'm still quite shy. So I wasn't used to talking for big audiences. And all of a sudden, the national television was there. And I had to coordinate a whole conference. And I was the president of the conference. And it was like so overwhelming. And then I just said to the national television, I have no time for an interview. I have to open the conference. And they were so offended that I said that, and that they had to wait like a whole day until the conference was finished before I could find the time. So these are things that I learned by doing, actually, because nobody ever gave me any media training. And then I remember at a certain point, the interviewer tried to put words into my mouth, like quite a racist remark, actually, because she tried me to say that I was going to say that all the Africans doing FGM are barbarians. That was, she wanted me to say that. So yeah, it was quite challenging, actually, because, the media, you have to be very careful, and actually you need a media training before you go out and talk to them. But then I was like, thrown before the lions and try to control a little bit the damage, but there wasn't damage. I mean, I was very careful in my communication, but still, it was like, a very overwhelming experience, but I learned a lot out of that one. So that was the very first conference, yeah. But there are other experiences, like, I remember we did a project in Sudan also, trying to set up an intervention on FGM in Sudan, and at the same time also in Burkina Faso, together with the World Health Organization, which was also quite a challenging project, because working with WHO it takes time. So it was really quite bureaucratic, actually, also to really do that project with WHO. But I like more the small scale projects and the small scale studies, and that you can really communicate with the local university and that things advance, instead of having through different committees before you can get a research protocol approved. It takes 3 to 6 months, and this is, for me, not my cup of tea.
I think that's a lot of that's one thing that a lot of people who start working in the field, a lot of young professionals are not aware of, that sometimes most of these bigger projects that we want to do is a lot of policy, bureaucracy you have to navigate, and you have to learn how to do. And I like that comment you made about being in that conference and being forced to represent, or to being put under pressure to represent people who perform female genital mutilation in sub-Saharan Africa a certain way. And I think, like what you said, sometimes it can be difficult in some of these issues to be able to apply a post-colonial or a reflective lens that is nuanced. Mm-hmm. And that's something, as you said, we always have to be cautious and careful about. Yeah.
Mm-hmm. Yeah, and I think it's sometimes also challenging to work with different disciplines. Like if you work from a public health perspective, it's totally different than an anthropological perspective, and sometimes it can clash also, But to me, it has always been an added value to work with several disciplines. But it's not always easy, and I think it's not always recognized as well within the academic world, how to work from an interdisciplinary perspective. It's something that is not really very well, maybe not very well introduced into the academic world yet. But I think an issue like FGM or gender-based violence, it really needs an interdisciplinary perspective. So you cannot just tackle it from a public health perspective or from a legal perspective. It's really an added value if you can bring all those perspectives together. Yeah.
No, that sounds very important. And I imagine, like you said, if even working on gender-based violence issues, when you're discussing it with someone that has a legal background, is so different from discussing with someone with a sociology or an anthropology background, or when I'm talking to health professionals, or even if you're not a service provider, you came into gender-based violence from a public health approach. Complete, like, worlds apart. And you always wonder, why don't we just get all of these people in the same room, let them talk to each other, and instead of trying to tackle it one bit at a time. I have a question for you. So in our work, as AISE consulting, and you know a bit of this, there's constantly this question about or this theme that comes about colonizing development. So encouraging more southern-based project practitioners or more researchers to lead some of the work in the global south. I personally feel there's a lot to be learned by multidisciplinary and expertise from different places. I love teams, working in teams where you have people from different countries, from different disciplines, because there's a richness to it. And I'm curious, how do you feel about that, especially in the field of gender-based violence?
I think we have been lucky. We both worked at the International Center for Reproductive Health, and that center has always been, you know, like a mix of people from Asia, from Africa, from Latin America, from Europe. So yeah, I think in a certain sense we were lucky to really be embedded in such a multi-country center, actually. And also the research that we did was always combining all kinds of countries, which is sometimes quite challenging. But especially with the issue of FGM and FGM in Europe, for example. Yeah, of course, in FGM Europe is not a high prevalence FGM region. If you look at some countries in Sub-Saharan Africa, or you compare it to some of the countries in Sub-Saharan Africa, but it puts you at certain challenges because it's a practice that has come with some of the groups that migrated to Europe. And then here, the health sector, the laws and the policies have been confronted with a practice that was unknown. So it really has forced us to really see how can we tackle it from a multidisciplinary perspective and also work together with the community. So I think in a certain way, yeah, I was forced from the very beginning to work from that perspective, to really, you know, to really involve with all kinds of people and disciplines and look at it from very different angles. So yeah.
No, I completely agree with you. And I think, as you said, it's very different when you're working on issues in the European context and working with people from migration backgrounds, because there are many different ways to do this, actually. Sometimes some of these people are seen more as, more as recipients or beneficiaries and not as stakeholders in the process. And like you said, because I remember working or doing some interviews a long time ago for one of the projects you were working on. And I think that approach of engaging with people as stakeholders, as not just as beneficiaries, but as, you know, engaging with them as equal stakeholders who can influence the process and also take some of the lessons learned into their communities is very powerful. And some of the work we're doing now is actually looking at how we can do better community engagement for sustainability in AISE consulting.
Visit https://youtube.b/jo1epc796 to watch the complete video. Thank you.